Cindy, thank you so much for coming on.
Oh, thank you for having me, Josh.
So tell us about the Medical Foster Home Program.
The Medical Foster Home Program at the VA is an alternative to nursing home care for veterans who, because of age or disability, need assistance and can't live at home alone anymore, not safely anyway. What we do are recruit homes to like yourself or myself. We could open up a home and take veterans in and provide them with all their physical needs and, of course, emotional needs. And then the VA comes in and provides the health care through our home-based program and provides the veteran with the health care right there in the home and also teaches that caregiver if there are special skills that are needed to be learned and supports them, supports them in caring for those veterans in their home.
You said that I could get involved if I wanted to. What would be the onboarding process for that?
Okay. The standards and requirements are similar to that of like state licensure, but you don't officially get licensed by the state. You get certified by us, certified by the VA. I'm not going to lie, it's the process is a little extensive, but for good reason. These individuals are taking care of our veterans and maybe a more vulnerable population. But there's a full team of folks who come in and who do inspections, and that's myself included, vetting the person and making sure they're not only experienced and skilled, but that they have the heart and the wherewithal to be able to do this kind of thing. But that team consists of not only myself, but also a nurse and a dietitian and a fire safety specialist and a physical therapist to look at all the different things in the home to make sure that it's up to standards to make a safe environment.
Very cool. Mm-hmm. On the other side of the equation, if I'm a veteran and I'm interested in this program, how might I become involved with it?
That's the nice thing, is that anybody can refer to our program. The veteran can, if you're a veteran, you could come to us on your own and say, hey, I need to look for long-term care options. But most of the time, the referrals to my program come from within the VA, but can also come from social workers or doctors or nurses in the community. It might be a neighbor or a church member who says, hey, this guy, I've heard about this program, this medical foster home program, and this guy might be really good for that program. So the referrals can come from anywhere. The veteran does have to be enrolled and vested in the VA's healthcare system in order to qualify. But everything else we handle and we talk about once we have the veteran in front of us.
Yeah. Mm-hmm. So what are some of the benefits of something like home health care versus nursing home care?
Oh, they're numerous. To the veteran, if that veteran desires to or doesn't desire to live in a facility, mm-hmm. if they're able to still be in the community, receiving the same sort of health care, but be in a home and be in a home environment, if that's what they desire, you can't really measure that, I don't think, as far as happiness and ability to still receive the care they need, but to still be in the community and to be in a home environment. But the benefits also are to the taxpayers, to the VA, to Medicare, Medicaid systems. Nursing home care is very expensive. Mm-hmm. It is, and the veterans are the ones who actually pay for the medical foster home program. When you look at pricing and you do comparison, mm-hmm. The VA medical foster home program is a lot less expensive, actually, at very least comparable to assisted living programs out in the community. So the taxpayers, the veterans, and then, of course, the caregivers. It benefits the caregivers, too. In addition to being a supplement to their income, let's face it, they're able to give back to our nation's finest.
Yeah, definitely. Mm-hmm. How, you mentioned, that it relieves the burden on the taxpayers. I was curious if you could just expand a little bit on how the program is funded. Okay.
It's actually really unique, and it is something I like to talk about. The VA, as far as our program here locally, my medical foster program here in Florida, which is 60-mile radius, I can go anywhere, 60-mile radius of our local VA clinic. Mm-hmm. And our local medical foster home program, the VA only pays for my salary and for a quarter of the salary of recreational therapists, for the program. And then, and does not pay the caregivers. Oftentimes you'd think, well, the caregiver's got to be paid by somebody, but like I referenced before, the veteran is the one who's actually paying the caregiver. So the veteran pays anywhere from $1,500 to $3,000 a month, depending on the level of care that they need. And like I said earlier, that's probably less expensive than a lot of long-term care options out there. And the savings really is what's incredible. Last year, I had 6 veterans here locally, and we alone saved our local Gulf Coast VA almost $1 million.
Wow, almost $1 million.
Yeah, right now we're over $1 million across the Gulf Coast.
Yeah.
But just alone, I'm talking about just my Florida, Pensacola area program.
That's impressive. Should be proud of that.
Yes, we are. And it benefits everybody.
Definitely. So I know I didn't know about the program until you told me about it. So I imagine there are some others who may be in that same boat. What do you think is the program's greatest need right now?
Homes.
Homes? Well, how many participants do you have?
Homes. Across the Gulf Coast, we have 12 veterans placed currently. We have 8 homes across the Gulf Coast. But here in the Florida area, my program specifically, we're really in need. We're only down to a couple homes. We lost a home last year. And every time we have homes, they stay full. The veterans at capacity. The maximum number of veterans who can live in one home is 3. So we don't ever feel like a group home or a facility, keeping the importance of that home-like feel. But yes, homes. That's what I need. I need individuals. We oftentimes will get people who are interested, who have the skills and knowledge and abilities and the heart. The most important part. But there's a process, like I said, for qualifying, and that is the home and looking at the home standards. And it's a little bit of a challenge, but the process, I think, is definitely the reward. Yeah. It makes up for any investments the caregivers and potential caregivers have to make.
Yeah. Well, it's a great opportunity. I think it's a fantastic program. And like you said, it saves a lot of money. It gives people the ability to serve our nation's heroes and gives our nation's heroes an alternative to nursing home care.
Absolutely.
Cindy, thank you so much for coming on today.
Thank you. I appreciate it.